But unfortunately, most of the hematuриas, most of the blood that goes in urine is not overt. It's microscopic, means you cannot see it. It's not overt hematuria. It's occult hematuria, means you cannot see the blood passing in the urine. And only 10% of patients present with these features. So there are other symptoms also. I'm going to come to that when I teach you the clinical features. In most cases, renal cell carcinomas metastasize widely before giving rise to any symptoms. That's why symptoms often come very late. Patient presents with symptoms very late, and depending if it has metastasized, depending on which organ has been affected, it can present accordingly. So not necessarily these three will be the clinical features, but at your level you must know, because examiner will ask you, or in exam question paper you may get these three features. One is costovertebral pain, one is palpable mass, and the other is hematuria. So out of these three, because our topic for today is renal cell carcinoma, and I'm going to keep it as crisp as possible. Okay, so predominantly it's adenocarcinoma, means the cell type, it's adenocarcinoma, depends on the cell of origin. Okay, and it represents 85% of all renal tumors, 85% of all renal cancers, sorry, because there are other cancers also. There is Wilms tumor and all you have studied for your first or second semester in childhood tumors. Okay, so it represents 85% of all renal cancers. Which age group it affects? Which age group it affects? Predominantly senior citizens, 6 to 7 decades. It can affect the 5th decade also, it can affect the 8th decade also, but 6 to 7, that particular 60 to 70 years is the period when maximum renal carcinomas are diagnosed. Males are affected slightly a little more than females. Males are affected a little more than females in a ratio of 2:1. Okay, and previously it was called hypernephroma. Hypernephroma. You know why it's called hypernephroma? Because it resembled the clear cells of the adrenal cortex. Because it resembled the clear cells of adrenal cortex, previously it was known as hypernephroma, but now it's clear that renal cell cancers, depending on the variant, it arises from the renal tubular epithelial cells. It has got nothing to do with the adrenal cortex, but why it is called hypernephroma is because it resembled the clear cells of the adrenal cortex. So any questions from here? Predominantly, what is the cell type? Adenocarcinoma, means renal cell cancers are predominantly adenocarcinomas, and they represent 85% of all renal cancers, representing 85% of all renal cancers affecting the senior citizens. Asking me what I should write in exams and all. See, all these are written exactly how আমি যেভাবে PowerPoint তৈরি করেছি, the way I have prepared the PowerPoint, it's exactly how you should write in an exam paper. Okay, give headings, put in bold, highlight wherever it's necessary. It will become very easy for you. So what are the predisposing factors? One is cigarette smoking. Yes, cigarette smoking, the organ which is affected the most is lungs. But that doesn't mean that cigarette affects only the lungs. Some visceral cancers can also be affected. Some visceral cancers can be aggravated by predominantly presence with the papillary variant of renal cell carcinoma. The most common is clear cell, then comes the papillary variant, then chromophobe and Bellini duct variant, whatever. I'm going to come into those. But patients who develop polycystic kidney disease after dialysis, this kind of patients develop renal cell carcinoma. And which variant of renal cell carcinoma they develop mostly? That is the papillary variant of renal cell carcinoma. Okay. Then CRF. What is CRF? CRF, chronic renal failure. Hypertension and obesity, especially obesity in women. Hypertension and obesity. Obese women are more predisposed to develop renal cell cancers. And then VHL. Have you heard of VHL? What is VHL? Huh? Von Hippel-Lindau. Von Hippel-Lindau disease. Very good. VHL disease. Then other diseases like tuberous sclerosis is also there, which I have not mentioned, but you can write down. So these are all the These are all the predisposing factors: cigarette smoking, exposure to heavy metals, petroleum, asbestos, etc. Then adult polycystic kidney disease, chronic renal failure, von Hippel-Lindau disease, tuberous sclerosis, and what else? Obesity, especially obese women are more predisposed to develop hypertension, this renal cell carcinoma, and hypertension. Okay, so these are the predisposing factors. Coming to the third point, genetics. Which genes are affected? See, exactly exam point of view theke ami porachi. This is being taught exactly from the exam point of view. If you write these points, you get a lot of numbers. Are you happy with your exam paper? Huh? Are you happy with the marks? That is VHL gene. VHL gene. What is VHL gene? Von Hippel-Lindau. So von Hippel-Lindau gene, the most common, VHL gene. VHL gene is located in which chromosome? VHL gene is located predominantly, VHL gene is associated with clear cell variant. It is located in in chromosome 3. So what exactly goes wrong? What exactly? There is loss of sequence in chromosome 3. There is loss of sequence in chromosome 3. Okay. Start. Loci where VHL gene is located. So there is loss of sequence. Loss of sequence means either it is deleted, either it translocation. Either it is deleted, there is deletion, that is 3p minus, or unbalanced chromosomal translocation, 3:6, 3:8, or 3:11, whatever it may be. Or sometimes the gene is inactive. Either mutation or somatic hypermethylation. So whatever it may be, ultimately it results in the loss of VHL gene, because ultimately it results in the loss of chromosome 3p and 3p. New blood vessel formation. New blood vessel formation will do what?